We often think about health as deeply personal, something that is shaped by our individual choices and habits. We focus on diet, exercise, and genetics, believing these are the primary determinants of our well-being. While these factors are crucial, we often overlook a powerful force: our neighborhoods, the very places we call home. Our zip codes can be as predictive of our health as our genetic codes, influencing our life expectancy and quality of life. They shape our daily lives, influencing our exposure to everything from pollution to fresh food, access to healthcare, and even social interactions. This isn't just about individual choices, it's about the environments we inhabit, the air we breathe, the water we drink, and the community resources available to us. In this essay, we'll explore the profound ways our neighborhoods impact our well-being, from mental health to physical health. We'll delve into the science, examine the disparities, and uncover the factors that contribute to a long and healthy life, regardless of where you live. Join me as we unravel this crucial connection between where we live and how we live, and discover what we can do to create healthier communities for everyone. Imagine two neighborhoods. One boasts lush parks, tree-lined streets, and easy access to fresh produce. The other contends with polluted air, limited green spaces, and a scarcity of healthy food options. Residents of the first neighborhood are more likely to be physically active, enjoy better air quality, and have access to nutritious foods. These factors contribute to lower rates of chronic diseases like heart disease, diabetes, and obesity. Conversely, residents of the disadvantaged neighborhood face an uphill battle. Pollution exacerbates respiratory problems. Lack of green spaces discourages physical activity. Limited access to healthy food options increases the risk of diet-related illnesses. The reality is that millions live in neighborhoods that don't support their health. Let's start with the air we breathe. The quality of the air around us plays a crucial role in our overall health and well-being. Neighborhoods with abundant green spaces like parks and trees act as natural air filters. These green areas are essential for maintaining a healthy environment. They absorb pollutants and release fresh oxygen, improving air quality and benefiting respiratory health. This natural process helps us breathe easier and live healthier lives. Access to parks and recreational facilities encourages physical activity. These spaces provide a safe and inviting environment for exercise and play. This, in turn, reduces the risk of obesity, heart disease, and other chronic conditions. Regular physical activity is a key component of a healthy lifestyle. Studies have shown that even a small amount of green space can have a significant positive impact on mental health, reducing stress, and promoting well-being. Nature has a calming effect that helps us unwind and rejuvenate. Furthermore, neighborhoods with access to affordable, healthy food options make it easier for residents to make nutritious choices. A balanced diet is essential for maintaining good health. Farmers markets, grocery stores stocked with fresh produce, and community gardens all contribute to a healthier diet and reduce the risk of diet-related diseases. These resources empower communities to thrive and lead healthier lives. Now let's consider the stark contrast between these environments. Disadvantaged neighborhoods often bear the brunt of environmental burdens, such as factories, highways, and industrial sites. These areas are frequently exposed to higher levels of pollution and noise. These sources release harmful pollutants into the air, leading to higher rates of asthma, respiratory illnesses, and even cardiovascular disease. Children and the elderly are particularly vulnerable to these health issues. The lack of safe, well-maintained parks and recreational facilities discourages physical activity. Without these spaces, children miss out on essential playtime, and adults have fewer opportunities for exercise. Residents may feel unsafe walking or exercising outdoors due to crime or lack of sidewalks. Poor lighting and neglected infrastructure further exacerbate these feelings of insecurity. This lack of physical activity contributes to a sedentary lifestyle, increasing the risk of obesity and related health issues. Sedentary behavior is linked to numerous chronic conditions, including heart disease and diabetes. Food deserts, areas with limited access to affordable, healthy food, are prevalent in many disadvantaged communities. This lack of access makes it difficult for residents to maintain a balanced diet. Residents may rely heavily on convenience stores and fast food restaurants, which often offer calorie-dense, nutrient-poor options. These eating habits can lead to long-term health problems. This contributes to poor diet quality and increases the risk of obesity, diabetes, and other chronic diseases. The cycle of poor health and limited resources continues, trapping residents in an unhealthy environment. Section 5. The research is clear, place matters. The impact of neighborhoods on health is not just anecdotal, it's backed by a growing body of scientific evidence. Numerous studies have demonstrated the link between neighborhood environments and health outcomes. For instance, research published in the American Journal of Public Health found that people living in neighborhoods with more green space had a lower risk of mortality from all causes, including heart disease and cancer. Other studies have shown that living in areas with high levels of air pollution is associated with an increased risk of respiratory problems, cardiovascular disease, and even premature death. The evidence is clear. Our zip code can be a powerful predictor of our health. Section 6. A cycle of disadvantage and disease. The unfortunate reality is that disadvantaged neighborhoods often experience a vicious cycle of poverty, limited resources, and poor health. These factors can create a perfect storm that perpetuates health disparities across generations. Children growing up in disadvantaged neighborhoods with limited access to healthy food options and safe places to play are more likely to develop unhealthy habits that increase their risk of obesity and chronic diseases later in life. These health problems can lead to missed school days, reduced productivity, and lower earning potential, perpetuating the cycle of poverty. Breaking this cycle requires addressing the root causes of health disparities, such as poverty, discrimination, and lack of access to resources. Section 7. Breaking the cycle. Creating healthier neighborhoods requires a multi-pronged approach. Investing in affordable housing, improving transportation infrastructure, and promoting economic development can help revitalize disadvantaged communities. Increasing access to healthy food options is crucial. This can be achieved through initiatives like supporting farmers markets, attracting grocery stores to underserved areas, and establishing community gardens. Making neighborhoods safer and more conducive to physical activity is essential. This includes improving street lighting, creating safe pedestrian walkways, and investing in parks and recreational facilities. Section 8. A look ahead, the healthcare gap. We've explored how our surroundings impact our well-being, but access to quality healthcare is another crucial piece of the puzzle. In the next installment of this series, we'll delve into the healthcare gap that exists in many communities and examine the factors that contribute to these disparities. We'll discuss the challenges faced by underserved populations and explore potential solutions to ensure that everyone has access to the care they need. Section 9. Join me next time. The link between our neighborhoods and our health is undeniable. By understanding these connections, we can advocate for policies and programs that create healthier environments for everyone. Join me next time as we continue our exploration of health disparities and delve into the complexities of the healthcare gap.